besides this little guy that is protruding a little bit too much, but this mouth is gorgeous. Just a gorgeous one. And actually, you can see.
This way, so you can get a better
Yeah, you can see anywhere you want.
Thank you. So you can get a better shot.
So this is very, very good. As a matter of fact, this same shot right here, that's her right there. Okay? So you have the whole thing right there.
That's your girlfriend?
Yeah.
Is that your girlfriend?
Yeah.
Oh, boy, you did
Do you
well.
feel bad when you
That's actually the day we met. So you see that these are very pretty teeth. I mean, look at that embrasure. It's gorgeous for a woman. You know, with a nice long teeth right here. It's very pretty. And those canines, very. Now, I don't know about that right there, but you know, that's just. She just used to go to a dental appointment and just clean that out.
Well, that's a floss problem.
Yeah, now we go to men, you know, and these are crowns. These are crowns that we have to do, you know, and you can see the discrepancy on everything. And, you know, when I do my courses, either for dentists or for technicians, I show pretty work, but I like to show the ugly work, things not to do, and take it apart. Because I also do cases that I'm not proud of, and it's something that I need to deal with. The doctor that wants it, like the case, the gentleman that I told you, he cemented it and the guy's not happy, or the patient wants it. You know, this was a very dramatic change on this gentleman. But here we have, you know, a very long tooth, and I don't know how bony this was here, but we could erase this little gum line here maybe a little bit. This looks almost like if it will be either a pontic or an implant there, but the tissue architecture is kind of strange there. But we did 7 on this, on the lower. And by the way, those lowers, if you guys want to do them chair side, like you're going to do the uppers now for this wax up, you guys are crazy. Because it's hard for a technician to do lowers. Usually lowers, you know this, they're driven by those upper linguals. So most of them are crooked. And they're crooked for a reason. Because those uppers are not allowing those guys to fit in the arch. So if we start cracking these guys and breaking contacts and putting the guys, we have pieces of rice in there. So we really need to convince the patient to actually accept rotated laterals on top of those canines a little bit from lowers. Will they take it? I don't know. But if we show them photos of that, I don't like lowers. I mean, these lowers are not that big. They look good in the mouth and you can chew with them, that's cool. You know, it's acceptable. But if we look at a nice lower, it doesn't look like that. But usually we do them because they're too rotated and overcrowded due to those uppers.
I try not to do. I've been doing a lot of single crowns with Eric, and I give them exactly the same position they are. I don't try to correct. I'm trying to do nothing. I do a lot of veneer cases, and I tell my patients, leave your lowers alone. Unless I'm going to do a full mouth reconstruction like this is a full mouth reconstruction. Okay, let's do it. But if not, just leave it alone.
Yeah.
It's just a peanut and egg.
Yeah, I agree. And you cannot go conservative. You gotta prep the heck out of them. You know, so I'll just leave them alone or adjust them so they can receive, you know, upper veneers. Because if we start working here and we start lengthening these guys, we definitely need this flat. Because if we have all this sticking out over here and so this patient is moving his jaw to the right or to the left and we have only one edge hitting the one edge, you know what's going to happen there. So we need kind of a group function. So we clean this up so all this stuff is gliding with this stuff. We agree on that, right?
Sure.
And these are things that you know, because you're a dentist and you work with patients, these are things that technicians need to know. Because when I get a case here from somebody that's not educated, and they say, okay, put veneers that are 2 millimeters longer than what the patient had before, and go for it, I have to say, well, hold on. Like this guy that I just told you about. I should have stopped the case right there and then, but I did. And that's when I have to marry the patient just like you have to marry the patient. I have to do my work for free. I can't charge again because we're on a top economy. I can't say, well, I'm Eddie Corrales, I'm going to charge again. I have to redo it for free. You know? So I have to look at all this stuff that I get in the laboratory. That's why, for me, a wax up is so important. Here we're going to work with just an upper. But ideally, we have a lower, so we can kind of check, even if it's hand articulating the case. You know, but at least we can check our function. That's very, very important.